My name is Annemarie Ford. Right. My nephew had flown in from Florida, where he lives part-time, and he went to a football game. And my husband went, and my grandson that I've adopted went up to Norwalk to a game. And the next day, he wasn't feeling well. So we're talking like October the 16th, 17th, and on the 18th, he ended up at Akron General Emergency, where he was having problems breathing. And his mom took him. And he has 4 sons. So therefore, they're like senior in high school and then on down. But when he went, he texted me because he was supposed to have been leaving that Sunday morning. And he texted me later on Monday and said, I missed my flight because I couldn't breathe. So when he went, he had double pneumonia in both of his lungs. And so as he was calling me to tell me and ask me to look up this medication that they wanted to give him, I'm at a store and I go like, okay, now I'm like panicking. He says, they say I have COVID. So I'm in the middle of a grocery store and I have a moment to hear that my nephew has COVID and he's 38 years old. And out of nowhere, he doesn't even know where it came from. Out of nowhere, he has this. So it was very heartening. He was incubated for 57 days, ventilator. Then he had a trach. I just found out when I was down in Florida last week seeing him that he's getting ready to go to New York in about 2 or 3 weeks to have surgery to take the scar tissue out of here, his throat. Just to know that we couldn't see him was the most heart-wrenching thing. And the prayers that I just prayed every day for him, I even wrote a prayer for him, every day for him to know that, is he gonna make it? When you can't see him, it's just, I think that was the most heartening thing was we couldn't see him and we couldn't touch him. We finally were able to do, Zoom or, FaceTime with him with a couple of the nurses and stuff. But just to see him, to know that, is he going to make it when you hear all the people dying and stuff. So it was, and then after he got out, right after Thanksgiving, he went to Select Care for rehab. And he said that he had a moment that he said, I'm getting out of here. I'm going to live. And if you hear the stories that he told about how he had these dreams that were like nightmares, like he was about to die and how he was fighting in his dreams, to hear that, and he said 2 weeks he was there and 2 weeks he left, he walked out. And they did a success story on him. And I bought the article because they did a success story on my nephew to say, he made it. He got out without a problem. And he had some tingling in his legs, but now he's been working out, with his trainer and everything, and he's doing excellent. So I'm just grateful to God that he got out.
My name is Dr. Jamisha Ford, and I am a resident at Akron General Medical Center. Considering like the historical trauma and exploitation of minorities within medicine. And so I never want to negate that or invalidate that concern. The vaccine, though, has shown to be very promising. I think the problem is that many people don't see what we see on the inside of the hospital, right? Like one day I'm admitting a patient, the next day I'm contacting the family to let them know that their family member didn't make it. But I think it's important to not only protect yourself, but to protect the people around you, for the people who don't have, as robust immune systems as yourself. And when you're looking at the data, it's pretty strong. When you're looking at the history of pandemics, like this is what helps us to eradicate these diseases that are killing millions of people. So I think it's important for people to consider that. And then when you're making any decision, it's also important to, weigh out the benefits and risks. So I know many people are concerned about the side effects. These side effects are temporary, but the side effects of COVID, the biggest one being death, is not. And then the side effects of COVID actually mimic the side effects of the vaccine, but they last longer. They can last up to 6 months, be it a muscle ache, brain fogginess, shortness of breath. So I think it's important to consider that. And then another thing that people are concerned about is like the long-term effects, right? Which is very valid. But again, you want to outweigh the benefits and risks. Am I going to risk getting potential or experiencing potential long-term effects from this vaccine? Or do I want to risk dying from COVID or killing a family member from COVID? Like I said before, I think it's very important when people are deciding on whether they're getting the vaccine or not. They just consider themselves, right? But they don't consider the people who have not been vaccinated, who cannot get vaccinated. And it's called a herd immunity, right? If everybody around you is immune or vaccinated to this certain virus, then you would, by default, be protected by these people. So a person getting a vaccine is not just protecting themselves, it's protecting the people around them. COVID is actually killing people of color, specifically African Americans, like 2 to 3 times more than our Caucasian counterparts. And the main reason is because people of color tend to live in close quarters with each other. You know, we live with family, our occupation, of course, implicit bias and discrimination within the healthcare system, but also healthcare utilization. A lot of us don't use our healthcare resources. And I just think it's important to shift our perspective of healthcare to look at it as a healthcare right. Like, it's our right to be vaccinated, and it's our right to be healthy and to use these healthcare resources.
My name is State Senator Vernon Sykes. I think it's extremely important with this pandemic going. It's not just here in this community or in Ohio or in the United States, it's the worldwide. And we need to do everything that we can to make sure that it doesn't spread anymore. Well, I think in times like these particularly, it's important that we follow the science. And the vaccines now have been tested and they've been proven to be extremely effective. And so these effective procedures will only help us save lives and promote public health. People in this community have entrusted me to be a leader. And I think part of that leadership is stepping forth in times like this to let people know as an example that it's safe and it's really the best and right thing to do.